Welcome to the ICDD book launch webinar of Decent Work and Decent Income Corona Crisis Experience. My name is Ismail Karatepe. I am the graduate school coordinator at the ICDD, and I'm pleased to serve you as the moderator today. And just to note, please feel free to let us know who you are and from where you are joining to us in the chat box. You can also join the conversation, well, as usual, through social media. You can use join the conversation on Twitter using hashtags DecentWork, COVID-19, and ICDD Live. Just to note, this event is recorded, and this event is going to also broadcast in our social media channels. Let me give a little overview of the event. We will have opening remarks by Christoph Scherrer, who is the editor of this book series. Then we will definitely leave some room for the editors at the very beginning and at the end. And we are also, I'm very pleased to say that we will have the introduction of 5 case studies. And at the end, as usual, we will have a question and answer session. This is where we want to hear from you. And you can use Q&A box. I mean, if you look at the Zoom, you will see at the very bottom to ask, you can ask the questions to our panelists throughout the event. But of course, we will be glad if you indicate to whom your question is, directed to. So you can also upvote the question and answer box, and then you can also comment on them. So please feel free that. Well, I mean, I think without further announcement, let me hand over to Christoph Scherrer. As I say, he is the editor of this book series. He is also economist at political sciences and professor of globalization and politics, and director of International Center for Development and Decent Work at the University of Kassel. Christoph, I think you are quite also known to our panelists. The floor is yours.
Thank you, Ismail. Well, I feel very honored that Pedro and Lygia have chosen my book series to publish their very important book on the responses to the COVID crisis on the state and labor level. The book series is hosted by the ICDD that Ismail has already mentioned. And the ICDD is also the host to the Global Labor University. And Lygia and Pedro have received their PhD at Unicampi, which is in a very important part of the Global Labor University. And they have assembled many of the alumni around the world that have participated in the Global Labor University in one way or another. So I think it's a wonderful example for cross-continental, not just cross-country, but really a cross-continental collaboration. And I hope that it will really support trade union worker solidarity also in the future. And I'm also very interested in listening now to the presentations. I have read the book, but I think presentations make it much more lively. And I wish you that you have an interesting book launch, and that many of those who are now listening in will also raise interesting questions. All the best for this book launch.
Thank you, Christoph. So then let me hand over to to Lygia Fares. He is right now faculty member at the Brooklyn Institute for Social Research. If I am right, Lygia, correct me if I'm wrong. And as just Christoph mentioned, he has also graduated from Uni University of Campinas, and his PhD on development economics. Okay, Lygia, you have the editor welcome.
Thank you, Ismail. Thank you, everyone. It's a pleasure to be here today, launching this book with all of you. This book is the result of a great collective work for almost 2 years. So 2 pandemic years, 2 different special years. And so I want to start by thanking Pedro Henrique for joining me in this project, and definitely for doing more than his share. Thanks, Pedro. I also want to thank all the authors. They were really kind, collaborative with us, with Pedro and I, and they share a lot of their knowledge, their expertise on their countries, and the case studies with us in this book. So I hope you all enjoy the cases that you're going to read. I also want to thank Professor Christoph Scherrer, who was a great supporter of this book since when it was just an idea. That was really key for us to, pursue this project. And I want to thank Ismail for all his support and Florian for organizing this book launch. I also want to thank Mrs. Madhupna Banerjee. She was the one who did the copy editing of the book. She was very helpful for us. Sorry if I butchered her name. I also want to thank Prem Jose for the cover photo, and Nomos, of course, and its staff for publishing it. So let me just share a little bit how was this idea, how the idea of this book came about. It was during an ICDD alumni PhD workshop that we had in Witzenhausen in 2019 in Germany. So the group expressed a desire to publish a collective book, and Pedro and I sort of promised that we would come up with a proposal. And as we all know, not long after COVID hit us all, right? So in February, and then Pedro and I thought that would be a good moment to engage people in a collective project, even if we had to all be isolated at home. So that's how we started. So in April, April 2020, we proposed the book, and COVID was already challenging capitalism and the world's production system, right? So economic growth was slowed down worldwide, and the consequences were already noticeable, like mass unemployment, people fear recession, fearing that inflation could rise, or we could have a deflation. Nobody really know what was gonna know. And additionally, the pandemic arrived to all of us in a time that neoliberal ideas, they really had redefined macroeconomic policies around the world and imposed contractionary fiscal, monetary policies, and reducing government capacity in general to deal with major crises like this one, right? So then, of course, labor relations after 40 years of neoliberalism was affected. Much of the labor rights, labor protections that were developed during the so-called golden age of capitalism had been dismantled. And what we saw was the intensification of precarious work, extension of the workday, flexible work schedules, and a lot of increase in informality. So then with this scenario, we ask ourselves how to talk about decent work, which is a common theme, right, for the ICDD during this specific time, like how countries were dealing with the current crisis and how workers are being affected by COVID and the lack of work, or the fact that they had to work under such harmful circumstances many times, right? So then we thought, well, let's ask, right? What are the possibilities and the limits of the decent work agenda when the world is facing a pandemic? And people really cannot work, but they still need to work or still need to have an income to survive. So that was our thought when we proposed to edit this book. We suggested a few broad themes like decent work or decent income, which became like the name of the book. We also wanted to hear about how COVID and the dismantling of the welfare state was impacting countries. We asked about labor relations and informality in the countries. We wanted to have cases on public intervention versus neoliberal policies. So, and we also highlighted to the prospect authors that we wanted to have all these themes analyzed in a gender and race perspective, right? So then we invited our colleagues to debate and contribute to the book. And the call was very well received by the ICDD community. And we selected 12 abstracts to compose the book. I also want to share that the editing process was very interesting. As editors, Pedro and I had the privilege really to encounter with realities from so many places. Like when we were isolated at home, right? We were having like firsthand experiences from so many different countries, seeing them through the eyes of our chapter contributors. And so we were able to learn different government strategies and understand worker struggles around the world during this very harsh moment, right? Just to continue a bit more, I hope I'm not boring you all too much, but to tell you a little bit about the structure of the book and to speak about the chapters and the countries a little. So the book includes 10 articles, 10 study on single countries and 2 cross-country analysis. Chapter 1 is called Dismantling Labor, How Essential Disability Support Workers Are Marginalized in Australia, Industrial Relations. This was written by Karen Douglas. Chapter 2 is about the gender impacts of COVID in Brazil. This was written by Ana Luisa Matos Oliveira, Luisa Cardoso, Raquel Guimarães, Luisa Nassif Pires, and myself. Chapter 3, the repercussions of dismantling Brazil's social protection system in the fight against COVID-19 by Paulo Malerba, who's here with us today, Mayra Mansour and Michelle Souza. Chapter 4, public policy choice of local governance under the COVID crisis in China. Is the e-voucher scheme prone to poor relief by Cheng Li. Chapter 5, COVID-19 pandemic, gender and informal work, voices from street vendors in Accra, Ghana by John Oti Amoah, who's also here with us today. Chapter 6, labor, gender and work in the regions of India during COVID-19 period by Wendy Manasi Bera, Clelia Casella, Amers Duan, Jie Kim, Zoe Williams, and Prabhat Yadav. Wendy is also here with us today to speak a little bit about the chapter. Chapter 7, Working and Surviving Under COVID-19 Conditions, Scenario from Agricultural Sector in India by Prem Jose. Sorry, it's very difficult, but yeah, Verna and Hamza Kia. So chapter 8, about the universal basic income phenomenon in Kenya by Maureen Kalum. Chapter 9, Poverty and Vulnerability of Agricultural Work in Southern Yucatan through COVID-19 by Francisco Ivan Hernandez and Cuerva Javier Garcia. Dr. Ivan is also here with us to present on his chapter. Chapter 10, the COVID pandemic as an agency for neoliberal shock doctrine in South Africa by Metembe Medlusa and Kalema and Ed Moriniti. Chapter 11, COVID-19 and the role of state in Africa by Isaac Mbulu. And chapter 12, Gender Dimensions of COVID-19 Pandemic by Aisha present, hiatus in Verna, who's also here with us today. So the book presents very interesting case studies, and they show us the intersection of agricultural work and state support in the Yucatan Peninsula in Mexico, the consequences of informality, of street vendors in Ghana, the impact of the pandemic on women, and especially in care work, and then in many countries, Australia, Brazil, Indonesia, Philippines, Uganda. It also talks about welfare state policies in Brazil, the voucher scheme in China, and the universal basic income in Kenya. We also have chapters on how COVID was instrumentalized for neoliberal shock, like in South Africa, or how other African countries were able to use state policies to mitigate the socio-economic impact of COVID. So the book has a lot and invites the reader to discover the national strategies in facing the COVID-19 crisis and how the consequences for workers were dealt with in different scenarios. So with that, I hope you enjoy the book launch, and most of all, enjoy the reading. Thank you all for being here today.
Thank you, Lygia. Well, let me directly, today we will have 5 case studies, and let us start with then Latin America. Well, let me then hand over to Ivan. Well, I mean, he's an economist, and he has a PhD from Autonomous University of Yucatan, and he is currently professor at the Maris University of Merida. Ivan, floor is yours.
Thank you, Ismail. I'm going to share my screen for a small presentation. Hi, everyone. First of all, I want to express my gratitude to the ICDD for the support of the creation of this book. And I also want to congratulate Lygia and Pedro for their leadership and coordination. My name is Ivan Hernandez. On behalf of my colleague Javier Becerril, co-author of the book and the book chapter, I will briefly comment our findings, short description of the chapter 9, poverty and vulnerability of agricultural work in southern Yucatan through COVID-19. Well, the content we are going to see is the context of agriculture, particularly in Mexico and Yucatan, the methods we use, and some findings that we discover. First of all, the context of Yucatecan agriculture. Well, in this chapter, we address the problem related to the social mobility generated by COVID-19 in rural areas, particularly in the southeast of Yucatan, Mexico. Due to social distancing measures and closure of business to mitigate the spread of coronavirus, many of the people employed in the service sector lost their jobs and returned to the place of origin to dedicate themselves, most of them, to the self-consumption agriculture. That is, the agriculture serves as a kind of unemployment insurance in many places. However, subsistence agriculture in Yucatan is developed in precarious conditions with little protective equipment, less production and productivity, and less diversified, and is primarily subsidized by government programs. So despite of this, agriculture has become a very important activity and is the primary source for income and food for many families in the areas with a high level of marginalization. Also in this chapter, we detail the state of Yucatecan agriculture. So we have addressed 3 main objectives, describe and characterize the current conditions of agriculture in Yucatan and from the perception of the farmers. Also, we estimate the changes in source of income and income inequality. And the third one, we calculate the impacts on income and food poverty reduction when carry out agriculture for the households. So the methods that we use from this case of study, we came with a quantitative approach. So we use a cross-sectional design, and we use a survey, a full income survey with 313 households spread on 23 localities. We can see here in the map of Yucatan. So we also calculate the food poverty lines in monetary terms. We use two econometric models. One, the logistic regression to calculate the probabilities of developed agriculture in households. And then an econometric model with the propensity score matching to estimate the impacts on income and food poverty. The findings. We discover, or we see precarious conditions with no affiliation to organization, insufficient income, hard work with no holidays. And from the second objective, we discovered that if we were an increase by 1% in public policy programs, in this kind of direct money transfers, decreases the Gini coefficients by 0.11, which translates into a lower income inequality in the rural areas. Also, the households that carry out agriculture, subsistence agriculture, have a monthly per capita income higher by $18. This, for you, maybe is not substantial, but in Mexico, it has a huge difference in the income. Additionally, reduce the probability of being in a position of food poverty by 14%. These are the findings, but we also want to enjoy the reading of this chapter and, of course, of the book. And I'm waiting for your doubts and questions. Many greetings from Mérida, Mexico.
Thank you, Ivan. Let me then hand over to John Amoah. John is a researcher fellow at the Center for Gender Research, Advocacy and Documentation at the University of Cape Coast in Ghana. And he is affiliate lecturer at the Center for African and International Studies. While his research generally includes gender, social policy, labor, and environment, which is the topic of today. John, the floor is yours.
Right. Thank you very much for the opportunity to be part, and as I bring you warm greetings from Cape Coast. We are enjoying the summer here in Cape Coast. All right. My chapter, as titled in the book, COVID-19 Pandemic, Gender and Informal Work, Voices from Street Vendors in Accra. The chapter actually focuses on the experiences of street vendors in Accra by highlighting their coping strategies with regards to the COVID pandemic, and also experiences with regards to how they make their livelihoods. For the purpose of this chapter, street vendors as a concept was conceptualized as a form of informal work or informal workers who engage in retailing activities on a fixed location on a street. It could also be on a fixed, non-fixed location on the street. So this is a category of informal workers, and they are normally invisible when we are discussing the discourses around informal workers, particularly in the global south. With methodology, I opted for the qualitative because I wanted to unpack the experiences. So unlike Ivan, who focused on quantitative, my chapter focused on qualitative, trying to unpack the experiences of these vendors. A little bit of context. Ghana recorded its first case of COVID on 2nd March 2020. And as a measure to curb the spread of the virus, the government instituted a partial lockdown on the 30th of March as a response to control the spread of the virus. However, during these 2 weeks of partial lockdown, there were cries all over the place in the media. There were fears that starvation was rather going to kill the vulnerable, in this case, majority are in the informal economy, rather than the COVID pandemic. So government was pushed to lift the ban on lockdown because most of these street vendors survive on a daily earnings they make on the street. So the ban was, the lockdown was subsequently lifted. Now, from the voices, it's clear from the data that we got that when in terms of the effects, there were generally decrease in the demand as well as income with regards to their trading activities. However, we observed differences with regards to women and men. The women were relatively affected, they were hit harder if you should compare to their male counterparts. And what accounted for this? The explanatory factor here was the fact that most of the men were trading in non-perishable goods, and the women were trading in perishable goods. So their customers were not patronizing these perishable goods, one, for the fear of contracting the virus and among other things. The other main findings was the fact that most of the, because of the general low demand for goods and service and also decrease in their daily earnings, most of the street vendors were forced to resort to their meager savings. And that is those who have savings. But those who were without savings had to resort to their working capital. So they used their working capital to survive when the pandemic was actually at its peak somewhere last year in Ghana. Another striking finding was the fact that the pandemic actually pushed new women and men onto the street to join the street vending already existing cohort on the street. So the pandemic pushed other people who were in other form of informal activities to the street as a way of surviving the pandemic. In terms of coping strategies, they adopted various strategies. One of the main strategies that they adopted was to relocate from the city to the countryside, where they could get food from farms. Also, most of them also had to, some relocated their children and still stayed on with the hope that things will normalize for them to make extra earnings and send some remittances to their families who are in the countryside of the country. Again, one of the striking findings that came up in this report was the fact that most of the street vendors actually resorted to religious and faith-based activities as a coping strategies. Some claim they were praying, others claim they were watching religious activities on TVs as a way of having hope and aspirations for the future. Responses from the government was very minimal. The government intervened in some aspects of the country by offering hot meals once a day, but the distribution was an issue. Most of the government support went to those in the formal economy. The other thing was that the government also subsidized utility. And again, many of these informal workers, in this case, the street vendors, claim that these benefits did not reach them. One, because most of them were invisible to the state. In terms of recommendation, we suggest strongly the need to actually take a second look at the informal economy, particularly those who are invisible to the state, in a way that we could actually design transformative social protection schemes that can meet their immediate needs, as well as also moving them into a more sustainable form of livelihoods. Thank you very much. And I'll end here for other colleagues to also share their experiences.
Thank you, John. Thank you for your introduction. Well, on my list, I have Wendy Olsen. She is originally from the States, but she has completed her master's and PhD degrees at the Oxford University. She works currently at the at Manchester University as the head of the Department of Social Statistics. And special fields include employment, gender, pay gaps, and gender norms. And Wendy, the floor is yours. Thank you very much.
Thank you. Thank you so much. I'm here representing a big team, especially Manasi Bera in Delhi, working at the Indian Institute of Dalit Studies. And Clelia Castella is currently in Rome, Amaresh Dubey in Delhi, G.A. Kim and Zoe Williams in Manchester, and Purva Yadav, we thank, who's also in Delhi at the JNU. And we were able to work together not only on this book chapter, but we did some further work to look more closely at the themes that came out. So our chapter is starting at page 131 in the new book, and I really congratulate everybody. I will summarize some of the findings in our chapter and also in the continuations since then, because certainly in the UK and India, the disease is still a very significant crisis. So the initial findings in this chapter, it was kind of trying to do hypothesis generation about decent work during this crisis, and particularly of the effects of lockdown. And we predicted that unpaid work would rise for women, which has happened. So the number of hours per day is really high for women's work when we include paid and unpaid work. But it was the unpaid work that increased and paid work reduced. And that includes informal sector work where the hours are not counted very exactly. But it happens that in 2019, the Indian government published a micro data set on time use, which was a really excellent source for finding out more about work, sort of going beyond the categories in the GDP. The commercial categories only look at paid work. And we also were later able to liaise with the ILO, and we worked with data from the Center for Monitoring Indian Economy, CMIE. We arranged data into a combined model. And so we've been able to take this research a bit further. So I will summarize that as well as this chapter. In this chapter, the key findings were about deaths and cases for a start, and then about labor and migration. And here we see those maps of India, a huge country in which 25 states are really very large, bigger than many countries. And the blue on the left shows areas with high numbers of cases, like Maharashtra, Karnataka, Andhra Pradesh, and coastal East India. Up in the north, Uttarakhand is showing as blue. On the right was the deaths, which were very focused again in certain states, as shown here. And this tragedy then is not uniform across the country, but the labor market structures are quite similar in the sense of the formal versus informal sector balance. And here on the scales of these two diagrams, you can see the ratio is 10-to-1 for informal sector versus formal sector work. And looking at the blue bars on the right, the agriculture sector is massively informal. So jobs lost in the formal sector affect mainly services workers and to some extent manufacturing. And some of those moved back into the informal sector during this 2020 crisis, which began in March. So looking at that, we're able to see that the return migrant wave had a huge effect on rural labor markets. People returned to villages. It was a great tragedy and really difficult even to get to their villages, and many did not go back. And that means more research needs to be done now about both the urban and rural labor markets. But we're particularly concerned about the gender effects of this, where women who are single heads of households with absentee husbands had to revise their arrangements to allow those men back into the household, which tends to reduce women's control over money, increase their workload, and particularly caring work. So the cooking is still done by the woman. We then did some studies of death rates using cumulative deaths across India. That data set in 2020 was not too bad, but since then data is not of high quality. because there's low reporting now for both COVID cases and deaths. But what we found was two pathways to this death outcome. One is obesity of an area was associated with more deaths, and I'll show you the details of that, but that's not in the book chapter. But the other is that in-migration of the poor is an aspect that does appear to put people at risk. And it's not quite clear what the mechanisms are, but this was a quantitative study covering 1.4 billion population. So here's the obesity pattern, which you can see if you plot the districts or plot the states shown here. It's quite strong. That's a very steep curve there for obesity affecting the risk of death. But along with the people, mainly well-off people who are obese, comes the use of servants and workers who are usually underweight, and underweight was also associated with more deaths. And we have here a lot of migrants. So everyone has agreed that migrant is the key contextual factor underlying the labor situation. So we, in our chapter, developed illustrations of where the in-migration is highest. These maps are in absolute number terms, and they show exactly the same areas. That is the manufacturing and agriculture in Maharashtra and the eastern coast of South India. There are some other areas there that you can see. So one has to really think about that and do further work, but there are multiple pathways to change here. And so we were able to merge some data sets, and this diagram shows the net effect on total work time that's paid work, which for women was a big decline. So W2 here is the time period at the beginning of 2020 when the lockdowns took place. And it's mainly the lockdowns that are causing this reduction in women's paid work. They had to leave jobs and they had to do caring, and they did more caring, but the women did not recover back that time of paid work, whereas in the men's curve to the right, showing a lot more time being spent on paid work, the men did recover their work back. Now, we were able to kind of revalidate this pattern, but I gratefully acknowledge Ashwini Deshpande, who had already published on this in 2020 using the CMIE data. It's the second of the two works cited here, 2020b. And others also have commented on the importance of the migration, both as a reason for being vulnerable to poverty and suffering and indecent work, but also for, vulnerable to the migrant return, which has affected those rural labor markets so much. So you have World Bank Group, Ravi Srivastava, Purva Yadav. And we did publish our death research in a journal. So that's come out in the EJDR journal. Previous work on time use we published in Slide Player. So we just wanted to bring all these patterns to attention to realize that there are multiple pathways of cause here, and women are being, doubly and triply badly affected up to now. Thank you.
Thank you very much. Christoph, you raised your hands, but you put it down.
I just wanted to congratulate these wonderful presentations in midterm, waiting for some others.
Okay, I'm going to then give the floor to Paulo. And well, Paulo has a PhD in political science obtained at the University of Campinas. Also, he's also from Campinas, and also master in political science at Unicamp. And he also a postgraduate diploma in global economic policies by the Engage program from the Global Labor University. Well, you have Paulo is working as a professor, and he's a union activist in banking sector as well. So the floor is yours.
Hello, everyone. Me, Maíra, and Michele are glad to be here today and to be part of this book, an important initiative from ICDD. I especially thank Lygia and Pedro for their support. We hope to contribute to this debate with our colleagues around the world. Our article called "The Repercussions of Dismantling Brazil's Social Protection System in the Fight against the COVID-19. The article seeks to demonstrate the effects of austerity measures such as the Constitutional Amendment number 95 of 2016 and the labor reform of 2017 has had on vulnerable populations, especially insofar as they have had been able to deal with the effect of the COVID-19 health crisis. These policies contributed to the increase of the population's social vulnerability and to the weakening of the state apparatus and how the scenario has had an impact on the effectiveness of COVID-19's coping strategies in Brazil. These measures constitute an institutional rupture with the principles established in 1988 Constitution in Brazil, the major milestone of the institution of the Retributive Pact in our country. However, we have observed a significant setback on the political pact established since 2016. The fight against the COVID-19 pandemic in Brazil encounters structural obstacles that expose millions of Brazilians even more to the disease. The amendment, what is the Constitutional Amendment 1905, and what are the consequences for the social protection? The amendment is an instrument that implements a new tax regime in Brazil and imposes a new form of public budget management from 2017 to 2036. The available budget will be the same as the 2016, increased by the inflation, only the inflation of the respective years, except to pay the interest and amortization of the public debt. In practice, by restricting resources for the fundamental social areas such as healthcare, education, for instance, the amendment creates a series of negative effects that depends on the public system. What was the labor reform and what the effects on the Brazilian society? The reform, the 2017 reform, modified this 117 of Brazilian labor law, entailing changes in the work relations, public institutions, and unions, profoundly modified the juridical order that regulated work relations and caused immediate social regression. The main measures implemented by the labor reform were outsourcing in all the areas, intermittent work, known as zero-hour contract, the hiring of the self-employed professionals, undermining of union negotiation, and creation obstacles to access the work justice, the labor justice in Brazil. Despite a wide change in the labor legislation, such measures did not succeed in reducing the unemployment and expanded the informal employment. What was the whole of the Bolsonaro's administrations on COVID-19 pandemic confrontation? The COVID-19 pandemic has hit a country with a far-right militarized government, submerged in a political crisis, aggravated by the poor economic performance, with around 13 million of people, unemployed people, debilitated healthcare system due to the historical underfinancing, but also especially after the approval of the amendments 1905. Some examples of the non-actions of the Brazilian federal government in the fight against COVID-19. The federal government has adopted and its discourse of false opposition between economy and healthcare. The federal government has adopted the stance of continuously demoralizing the expert initiatives and recommendations, even those of the Ministry of Health itself. Medicines without proof of effectiveness against COVID-19 were disclosed and distributed to the population. The absence of national coordination established a scenario of political tension with the levels of government and lack of national effort to confront COVID-19. The federal government's lack of transparency as in the attempt to do not declare the total number of deaths and confirmed case of COVID-19. Finally, to conclude, the reforms for the market within the concept of the neoliberalism, combined with the denialist political actions of the Brazilian government, worsened the crisis and left the Brazilian population more exposed to the disease and poverty. Is our conclusion in this article. Thank you very much.
Okay, let me then shortly introduce Verna. Well, Verna is a postdoctoral researcher for the Rosa Luxemburg Foundation. And but what is also quite special that she has also completed her PhD in ICDD in International Center of Development and Distant Work, University of Kassel. And what's also so special for me, we have completed our PhDs together. She currently works with Philippine trade unions.
You're right. This article is special for me because I wrote it together with my PhD cohort at the ICDD, and we are very proud about this chapter because we really collaborated well, and our working relations with Aisha and Henrique were quite really good. And I think we joined our minds together. I would like to introduce my co-authors in this chapter. Aisha Namukasa is currently an associate postdoctoral research fellow of the Global Partnership Network, UNICASL, and a trainer at the GLU Online Academy. Henrique Sinaga is currently a postdoctoral fellow at Friedrich Schiller University, Jena, Germany. Her research interests are labor rights, labor relations, gender, and trade liberalization. They're both in Europe right now, and I'm in the Philippines, but unfortunately, they cannot join us today. Quickly, I would like to say something a little bit about our article. At the height of the COVID-19 pandemic, we exchanged experiences that became the basis for this book chapter. As we were locked down and affected as well as women scholar activists, we decided to focus on the situation of women in the healthcare sector. As women comprise 70% of healthcare workers, we witnessed firsthand the impacts of the pandemic to the working people in general and healthcare workers in particular. During the first wave of the COVID-19 surge, healthcare workers were among the first victims to get infected while caring for the sick. But looking deeper into the situation on the ground, the lack of just compensation for healthcare workers and lack of protection amidst the risks they had to face every day are manifestations of what we think neoliberal economic policies that shape the healthcare sectors in our countries, namely Indonesia, the Philippines, and Uganda. We also have common criticisms on the securitized pandemic responses of our governments and anti-democratic practices of the state during the pandemic. The article sketched the current political regimes in the three countries that shape their preparedness and responses, the differentiated impacts on women specifically working in the healthcare sector, and the challenges and prospects for women's economic and political rights in the context of decent work. We based our analysis on social reproduction theory to understand the neoliberal market ideology that devalues care work and privatization of healthcare sectors, particularly in developing countries such as ours. In looking at the securitized and authoritarian responses to control the contagion in our part of the world, we utilize the feminist secure economy frame of analysis. The global coronavirus pandemic has put pressures on the government across countries to take exceptional measures, signaling the efforts to securitize the pandemic. Such measures coincide with certain political contexts in several countries, which either see an authoritarian in the Philippines or democratic decline. Briefly, let me outline the highlights of our case studies. The Philippine case study discussed the authoritarian pandemic responses of the Duterte government, such that there were more people arrested violating health protocols and curfews rather than being tested of COVID. The article also exposed the weak healthcare system in the country. The impacts of the pandemic exposed the structural, economic, social, and political inequalities. The pandemic opens the Pandora's box of the crippling response of authoritarian and neoliberal political economic systems, which structurally devalues care work. In this global health crisis, the women's role in social reproduction becomes most crucial, as women can be found on the front lines of healthcare, public services, and essential services to live within the pandemic. In these uncertain times, it is imperative that the evolving new normal responds and highlights the crucial role of women in building a better and resilient world. In Indonesia has the highest COVID-19 infections in Southeast Asia and closely followed by the Philippines. The Indonesian case study discussed that the government, instead of rolling out funding to prepare public health infrastructure, the Indonesian state launched initiatives to boost tourism, including spending a significant amount of money to pay influencers. In putting the economy first, the Indonesian government's pandemic response was slow and incoherent in controlling the contagion, making the healthcare workers bear the brunt of rising infections. Despite being dubbed as frontline or essential workers, healthcare workers had to struggle with pay cuts and bonus slashes during the pandemic. Whilst it was argued that the pandemic responses were not fully militarized, it was contended that the military has used the current crisis to boost its institutional agenda. The return of the dual function of the Indonesian military during the pandemic also indicates the efforts to securitize the pandemic. In the case of Uganda, the authoritarian President Museveni immediately announced an extensive list of strict measures, including closing the Ugandan borders, both land and air, shutting down all institutions of education, a ban on both public and private transport in the first days of the pandemic. Uganda is one of the several African countries where security forces have used repressive measures to enforce restrictions to movement. There were several presidential directives issued to enforce lockdowns with respect to public health. Similar to the Philippines, the weak healthcare system in Uganda has also been exposed during the pandemic. Though the healthcare sector is regulated, workers in this sector face flexibilization and increased working time, yet they lack protective gear and work under indecent working conditions. In conclusion, the article highlights the role of women in the healthcare sector and their precarious conditions, the weak healthcare systems under neoliberal economic policies, and the securitized and authoritarian pandemic measures enforced in these three countries. As women played a central role in sustaining life amidst the pandemic, their involvement is imperative and needs to be put at the core of the national responses against the coronavirus pandemic. Thank you for your attention.
Thank you very much, Verna. Okay, I guess I didn't miss anyone, and we can then start our question and answer session. Please feel free to write your question on Q&A box, just down there, very bottom of the Zoom application. But we have already one question, and I think I'm going to read it loud. And the question is coming from Michelle Souza. Please forgive me if I pronounce the name wrong. The question is how the health system in each country was organized even before the pandemic, in the sense of whether they were fragmented, and how fragile health systems or those aimed at certain social groups were organized in the face of a pandemic like COVID-19? I guess this question is not specific to any authors, but I guess Wendy would like to start with that.
I thought I could just start off with two dimensions of that fragmentation in India. One is the public-private split. And you might have heard that the private hospitals ran out of oxygen at one point. Meanwhile, the public hospitals were also suffering, but they have a different structure. And after that period, the Indian government actually began a systematic devolution of this topic of care for COVID to the state level. And so that was a big change in a federal system. And so in the end, it's very fragmented. So I think it does draw upon the theme that Verna has introduced of neoliberal authoritarian governments, where the first stage was very authoritarian or very state-led, but then that wasn't really working very well. It hasn't protected lives very well in India. And then they, in order to avoid the responsibility, I think, led to more differentiation across the states. And then that was just not very effective. So I think that's just a starter for that health system question.
Can I ask a very follow-up question, Wendy? The issue is, I guess, it has two dimensions, as Verna say. One of them is neoliberalism and the fragmentation, public-private separation, and the other one is authoritarianism. And we have seen reports that some are more privileged than others. In the case of India, in a sense that party membership or being close to bureaucratic ranks plays a role, I suppose, in accessing the public services. The reports that we have read from the newspaper, is this something also that you come across in your research?
We haven't done the research on the corruption. We know that the corruption is there, and it does vary from place to place. But we have in the room today some of the experts from India. I think I asked Professor Dubey, would he like to comment on that question? Because it is a good question. The thing about what can be called corruption is the social networking. So if you're in a private hospital run by certain groups, then you may find that certain people associated with those groups get access to the hospital. There's always a shortage of hospital places, and COVID made that much worse. But there are many, many people who cannot ever be treated in a private hospital, and those are the people who are using the state system. So this is quite common. I think it's not just specific to India. And in the state system, different, routes can be found for getting access, including just having some money. And for those with no money, there's no hospitalization, and then there's no record of the case. And that's why, in the end, we think that the current data on COVID cases is way too low. COVID deaths is completely unrecorded now in India.
Well, there's one more question for our Brazilian, probably especially to Brazilian authors, but for everyone, I'm reading loud. In Brazil, we can see the growth of poverty, especially related to more vulnerable social groups. And I would like to know if this scenario has been noticed in other countries and what the most significant policy measures have been implemented.
Well, let me share a little bit from the case of Ghana. Hello, can you hear me?
Mm-hmm. We can hear you.
Yes. In the case of Ghana, things I would say for now have normalized a little bit. Like the economy is picking up with regards to livelihoods, because you don't have it. When we talk about the hospitalization, it is not as when the pandemic started. So things are really normal, and people are going about their normal activities, even though there are concerns with regards to the new variants, which is spreading, but hospitalization has been very, very low. So that's the case, the situation in Ghana as of now. Thank you.
I'm just looking at other participants. Do you have any also answer to that? If not, then I would like to go another crucial question that is right now in the chat box. And this is a question directed to the editors. Directly to the editors. Why did you choose this book title? The case studies show the dilemma of income versus decent working conditions?
Well, maybe I can speak about it a little bit. I try to comment on that on my introduction, so thank you for the question. So what we thought was like, it was very difficult to talk about decent work in that situation, right? When people was actually required to not work, to be, socially distant and all that. But at the same time, people still needed to eat, still needed to have an income, still needed to have their needs fulfilled. And we all know that under capitalism, the only way to eat is you sell your labor power. So that was intriguing for us. And that's why we came up with decent work or decent income, whether if, thinking about work was really the key at that moment, or the key would be how to have like an income and assure people's survival in this moment. I think was our reasoning. Maybe Pedro wants to add anything.
I just would like to add that decent income is one of the dimensions of decent work, the discussion on decent work. And of course, all of the papers, they're not discussing directly the decent income and the question about the relationship between income and decent work. But some of them are discussing specifically this theme, like the paper wrote by Cheng Li is discussing how to provide income for China workers. But I think most of them are, if they are not discussing exactly at this point, somehow they are in some point of the papers they are discussing this. And also because one of the main problems during the pandemic situation was how to provide income for the workers, especially those who lost their jobs. They were unemployed. So this is why we chose this title.
Yeah, thank you. I'm at least I'm on the. I can see who others are there, and well, yeah. Hello.
Hi.
Hi.
Yeah, that's perfect. We can hear you. We can see you. So we just want to hear about the health sector there.
Well, a health sector, if I remember, not if I actually, the question was about the way this service delivery in the health sector was managed, and obviously there has been a hint towards corruption. So one of the things that is that's the way I will start is that, well, corruption is something that is that. It doesn't vary in kind, but it varies in degree across the space. And it's not specific to India, but in the rest of the places. In fact, somewhere or the other, there is something that goes on. In case of health sector related issues, somehow the private sector started playing increasingly more and more role. So the private provision of medical services or health services turned out to be much more prominent than the public sector. And that's why, I mean, in one of the studies that we carried out, in fact, is a part of the ongoing program that we have on India Human Development Survey. And we did look at the availability of public services in health sector at the village level, at the lowest level in the rural areas. And it turned out that although initially these services were started, they were there, but somehow they just disintegrated, or they are on verge of integration. And along the way, the private sector started filling the gaps. That is where the bigger problem lies. It's more of a affordability and cost of the health services that was an issue, rather than the public services or the public provision of health services. That's the way some of us look at on this whole issue. The second point that I want to make is about the pandemic itself. Perhaps there was a bit of, I won't say carelessness, but there was a bit of lethargy after the first wave passed off relatively less damaging. And when the second wave came in 2021, that is when perhaps everybody was caught off guard. And that resulted in, one, the private sector itself wasn't so much equipped. Some of the services that were required were to be perhaps provided, or that's the way the provision exists, to be provided through public sector or through public schemes. And that this mismatch actually resulted in a kind of a much more severe effect of wave 2. Yeah, that's these are the 2 points that I take. Yeah.
Thank you very much. And meanwhile, I have received a new question. Is addressed to Paulo. Could you elaborate on more on what you have referred to as a dismantling the social protection system in Brazil, in particular based on your findings, which neoliberal policies were most significantly responsible for exacerbating the impacts of the COVID-19 on the working population? It's a question from...
Yes.
It's a question from...
Sorry, I without the video. My image is not appearing, but I can answer here.
Sure.
Okay. Yes, neoliberal measures weakened the incipient welfare state in Brazil, leaving the population more vulnerable and exposed. There was a weakening of public health system, prevention, but not only that. An important factor was the drop in formal jobs, more protected jobs. Many Brazilians had to expose themselves to the COVID-19 to survive, as they had not guarantee of income. So one problem of the neoliberal measures was to leave people more vulnerable to the disease, and it was necessary to work to survive. So it's directly related, the 2 questions.
Then I couldn't see any question. Then I would like to abuse my role as a moderator to raise a question. If you definitely not, if you don't mind. I read the chapters with a great interest, and what actually then what was quite interesting to me, the certain parallelity in the global south, but especially I'm asking to the authors, to the editors, what actually then what differs the different country? Did you see any divergences in terms of responses? Did you see any? Did you reflect on any differences, or what you have observed? Is there a kind of a parallel policy response? So that was a question from Lygia and Pedro.
Maybe I can comment quickly and then Pedro wants to complement. Yeah, I was just gonna say that what's striking to me is to see how structurally the Global South is similar, right? I do think like that the responses were a bit different. They were more conjunctural, right? They were more, well, it depended more on who was in power, and that was I think that was obvious from the case studies. But the problems, they are really structural. That was what I was more, I don't know, I was able to observe, and what struck me the most. It was also clear the gender perspective as well. I think it was, of course, we could see that in Australia, it's also an issue, right? But how care in the Global South is has an extra burden, I would say, like maybe a third burden, right? Like we are able to talk about two burdens, like for women, but like maybe the Global South, due to the lack of structure and due to lack of public policies, and then we have like maybe a third, a third burden, I would say, on women on the Global South. They were more impacted by informality. They are more, right? And then because of the pandemic, all that makes it more complicated. They couldn't work, and if they wanted to protect their family or care for their family. And it was, I think this was clear from a lot of cases. That's what I noticed.
And just to add some point, I think that my impression is that the possibilities and the possibilities to face the problems, even though all of the countries are facing the more or less the same problems, which is the problems that came up with the pandemic situation. The capacity to respond to this crisis, the social crisis, the economic crisis, and the health crisis, it's completely linked to the social structure of each country. So even when you compare underdeveloped countries, they have different resources, they have different structures, they have different capacities to face the problems that came up with the pandemic. So this is something that really was remarkable to me in the reading the papers and discussing the experiences, that all of them are facing more or less the same problem, but they have different resources and capacities to face these problems, because they have different social, political, and economic structures. So this is something that I would like to add to Lygia's.
Thank you very much. Then perhaps on this note, Pedro, I can definitely hand over to you, well, as one of the editor, and probably you can also close the session. Well, but let me introduce you. Pedro studied economics at the Federal University of Uberlândia in Brazil, and he finished his PhD in economics development with an emphasis in social and labor economics by the State University of Campinas, Unicamp. And currently he's working at Federal University of Goiás. So Pedro, for the closing remark, floor is yours.
Thank you, Ismail. I'm not going to take long to finish this session. I just would like to join Lygia to say some thanks. And first of all, I want to say thank you for Lygia. Lygia and I, we know each other for such a long time. We did our PhD together. We know each other for more than 10 years now. But this is the very first time that we work together in a project that we started to think about it in the last ICDD workshop in Bitsen House in 2019. And it was a really pleasure to have the opportunity to work with you, Lygia. So thank you so much. I think we face so many problems and so many questions during the process, but I'm pretty sure that we learned a lot, and I really want to have the opportunity to work to you again. So thank you so much. And I also had to thank for Christoph Scherrer to have accepted our idea and this idea to organize a book for ICDD, and in this collection, which is organized by him. So Christoph, thank you so much for everything, for all of the ideas and discussions that we have over this time. I also want to say thank you for ICDD staff, for Ismail and Florian, who has been really helpful during the last months, helping me to organize this book launch. Florian, thank you so much for everything. And also Ismail, you're always really friendly and accessible. So thank you so much. And for those who help us with the copy editing, which for me was one of the most difficult parts of this job, is editing the book. And also for the Nomos staff, the editors, and at least for the authors, at the end for the authors, thank you for your contributions, and especially for those who are here, who could be here today to say some words about their papers. And just to finish, I would like to say something about the experience in organizing a book. This is the second book that I had the opportunity to organize, but pretty sure that is the first experience being with so much responsibility, because at the very beginning it was just Lygia and I. So it was, as I said, it was really difficult. It was really challenging. Lygia and I were facing so many personal problems during the last 2 years. And we also had the pandemic situation where we were closed in our homes. So it was really difficult to work in these conditions. But the fact that was really challenging for me was real opportunity to learn a lot. I'm pretty sure that the next experience of organizing a book will be much easier. So I'm really happy to be here today in this book launch. I'm really happy with the results. I'm really happy with the papers, the contributions. I think we could make something really interesting. And I'm really sure that this book will be really helpful for trade unions, for political parties, for workers, for social organizations to think about, especially what's coming next. I mean, we are still in the pandemic. We are not sure the next problems that we're going to face. So I still think that we have so much things to face regarding the pandemic, and hope that the book help everybody to think about what the governments and what the social organizations can do to promote decent work, to promote decent income, and to help the workers to live in better conditions. So thank you so much for everything, for everybody, and especially for the audience that is here join this section. So thank you.
Well, Pedro, I should have done a correction. Sorry, it's not 10 years, it's already 13 years. And
Thanks, Ismail.
Thanks for reminding us our age.
Yes, exactly.
Well, on behalf of the ICDD, thank you for joining this special book launch. Book launch of Decent Work or Decent Income, Corona Crisis Experience. Thank you for your all panelists as well as all authors of the book and everybody involved in this successful publication process. This has been always a collective process. And needless to say, you can follow us on our social media channels for future events and announcements, as well as for this event. This event will be also available on our social media channels quite soon.